Hello everyone. Today we will go on heart failure. First, let's talk about diagnosis of heart failure. In clinic world, we diagnose heart failure with medical history, symptoms, signs, and the results from the exams. Usually, there are some manifestations in ECG, such as changing in heart rate. Sometimes we can find arrhythmia in ECG. Mostly, we use echocardiogram to diagnose heart failure. By using cardiogram, we can determine the underlying causes of heart failure. We can also assess the severity of ventricular dysfunction. Here, we should know the normal ejection fraction should be higher than 50%. If the left ventricle ejection fraction decreases and lower than 50%, we can diagnose heart failure straightly. We use New York Heart Association functional classification to classify heart failure. The first level is Class 1, no limitation of physical activity, and no symptoms with ordinary exertion. The second level is Class 2, slight limitation of physical activity. Ordinary activity causes symptoms. The third class is Class 3, marked limitation of physical activity and less than ordinary activity can cause symptoms. Patients can suffer short breaths at rest. The last level is Class 4. The patient inability to carry out any physical activity without discomfort. The patients will suffer dyspnea at rest. Next, let's talk about the treatment principles. The most important is we need to let the patient feel most comfortable and to improve life quality. At the same time, we need to treat with primary disease which cause heart failure. And we have known the mechanisms of heart failure include neurohumoral system problem. So we need to use medication to recover the neurohumoral system activation. Next, we need to give medication which can give inhibition of progressive ventricular remodeling. Next, the final aim for our treatment is to reduce mortality and extend life. When we use medications, we can choose diuretics, vasodilators, and cardiac inhibitors to treat with the symptoms of heart failure. We also can use ACEI, ARB, and beta blocker, and so on, to extend the life and to reduce the mortality. For acute heart failure, it means extreme degree of breathlessness and anxiety with sensation of suffocation, sitting up, gasping for breath, pale, and cyanotic. And we can find rills extending from base upward to fill the whole chest. At first, blood may be elevated. In severe situations, blood pressure will drop. We know the cause of acute heart failure include infections, allergic reactions, pulmonary embolism, damage by virus, cardiopulmonary bypass surgery, and heart attack, etc. When we treat with acute heart failure, we should put the patient in sitting position, give proper concentration of oxygen. Sometimes we use morphine and furosemide. Sometimes we will use digitalis. Thank you.